Coming to the anatomical landmarks, I'll be detailing the important features of this particular bone so that'll help you basically identify the coccygeal bone. Out of the 4 segments, the very first coccygeal bone has the most distinct features, so we'll be discussing that in detail. On a quick glance, it resembles a reindeer-like structure having horns. As we compare with the rest of the segments, it is the largest coccygeal segment. It is usually found as a separate vertebrae. Again, as we discussed in the anatomy of the sacrum, even the coccyx is also an inverted pyramidal in shape. If we go into the anatomical details of the coccyx, just like the sacrum, it has a base and an apex as well. The base of the coccyx gets articulated with the apex of the sacrum, forming a fibrocartilaginous joint called the sacrococcygeal symphysis, while the apex is a free-ended structure. Now, another very significant feature of the coccyx bone is the coccygeal cornua. There are basically horn-like structures present posterolaterally coming out of the base. They are articulating with the sacral cornua and connected by the intercornual ligaments. Rudimentary transverse processes are again a striking feature projecting laterally and may articulate with the inferolateral angle of the sacrum. And ultimately, it is resulting in a 5th pair of a sacral foramina. Now coming to the 2nd, 3rd, and the 4th coccygeal segments. Now, if we look at the 2nd, 3rd, and the 4th coccygeal segments, they are merely bony nodules successively diminishing in size and fused together. The second piece may show rudiments of transverse processes too. Now, in between these coccygeal bones, we have the intercoccygeal joints, which are usually ossified, but in some instances they may be synovial, or sometimes a thin disc of fibrocartilage is present in between them. And sometimes it is a combination of both. Usually, individuals have 4 coccygeal segments, but remember, we have some physiological variants in which we have 3 or 5 coccygeal segments, but they pose no threat to the health of the individuals. Now, if we look from a side view, this coccygeal bone is slightly curved inward, and that is why it makes certain angles in the spinal curvature, and they are extremely important clinically. The first angle is the sacrococcygeal angle, which is formed at the sacrococcygeal junction. This angle is formed between the end plates of S1 to S5 and from C1 to C4. For details of this angle, do watch the lecture Sacrum on sqadia.com anatomy course. Another very important parameter is the intercoccygeal angle, and it has clinical weightage too. It can be measured between the first and the last coccygeal segment as shown here. It is basically present where the intercoccygeal joint can be found. The mean value is almost 140 degrees, and as the angle becomes more acute, the coccyx will be facing more anteriorly. Now, even in normal individuals, the coccyx is slightly angled anteriorly, but there are some variants in which these angulations can make a person more prone to the development of conditions like coccydynia, as we discussed in our case study. The receptionist we talked about was probably suffering from these conditions. There are basically 4 types of coccygeal variants. Type 1 individuals in which the coccyx is inclined a bit forward with its apex pointing more caudally, and it happens in almost 70% of the population. Type 2 individuals where the coccyx is pointing more anteriorly. That is, the apex is pointing in the forward direction. It happens in almost 15% of the individuals. Type 3 individuals, in which the coccyx is sharply angulated between first and second, or the second and the third segment. This happens in almost 5% of the patients. In type 4, the patients are suffering from subluxation, which is basically when the joints are dislocated at the sacrococcygeal joint or between the first and the second coccygeal segment. This condition happens in almost 10% of the population. Now we even have a type 5 in which we observe that there is a straightening of the coccyx in the individuals, and type 6 in which there is a sideways deviation of the coccygeal bone. From type 2 to type 6, these individuals are more prone to the development of painful coccygeal conditions, and that is why it is clinically more important to diagnose these variants. Just for your information, caudal epidural and caudal nerve block injections are steroid injections that are given in the coccyx, that is basically the tailbone or the caudal region that we are discussing, to treat the chronic lower back pain and chronic pain in the legs. Now we are well versed with the anatomical landmarks of this tailbone, which is known as the coccyx. And now I'll be discussing the important muscular attachments that are present over here.